Breast cancer, it can feel like such a complex and honestly an intimidating topic. So what we're going to do in this explainer is cut right through all that noise. We're going to break it down step by step into a simple guide, starting with the absolute basics and ending with today's most advanced treatment strategies. Now, to get a real sense of why this is so important, let's just start with one number, 25%. Think about that. That's how many of all new cancer diagnoses in women are breast cancer. It really puts into perspective just how significant this is. So what are we actually talking about here? Well, at its very core, breast cancer is a harmful growth, a tumor made of abnormal cells that starts inside the breast. And as we're about to see, the exact spot where it begins, well, that changes everything.
All right, so here's our game plan. First, we'll lay the foundation. Then we'll look at the different blueprints, the types of cancer. After that, we'll cover the clues and warning signs, walk through how a diagnosis is confirmed, and finally, we'll get into the strategies for treatment.
Okay, first up, the foundation. We've got to get a handle on the basic anatomy to really understand where and how this whole thing gets started.
So just think of the breast as having two main working parts. You've got the lobules, that's where milk is made, and then you have the ducts, which are basically the tiny tubes that carry the milk. And here's the key takeaway, the most important part. Almost all breast cancers begin right there, inside one of those two structures.
Okay, so we know where it starts. Now let's dig into what it is. Because breast cancer isn't just one single disease. No way. It's more like a category of different types, and each one has its own unique blueprint. So the very first big question is this. Is the cancer contained, or has it started to move? On the left, we've got what's called carcinoma in situ. Think of it like this. The abnormal cells are still locked inside their original container, the duct or lobule. But on the right, you see invasive carcinoma. Here the cells have broken out. They've started growing into the tissue around them. And that distinction, right there, is a massive fork in the road. Now, you might hear this pretty technical-sounding term, adenocarcinomas, but don't let it throw you. All it means is that the cancer started in the glandular cells, the ones that line the milk ducts and lobules we just talked about. Simple as that. But, knowing the physical location is really only half the story. To come up with a truly effective plan to fight it, we've got to go deeper. We need to understand the cancer's molecular instructions, its unique blueprint. And this molecular blueprint, it really comes down to answering three key questions. First, is the cancer being fueled by hormones, like estrogen or progesterone? If the answer yes, we can literally cut off its fuel supply with hormone therapy. Second, is it making way too much of a protein called HER2? If it is, that can make it grow faster. But, and this is brilliant, we have special therapies that target HER2 directly. And if the answer to all three is no, well, that's called triple negative, and it's a bit trickier because it doesn't have these common targets. So, armed with all that knowledge about the different types, let's switch gears and get practical. What are the clues, the warning signs that we should all be aware of? So, what actually increases a person's risk? Well, there are a few key factors. For a small but really important group, about 5 to 10% of cases, it's linked to genes you inherit, like BRCA1 and BRCA2. Hormones also play a big part, and so do lifestyle factors. And finally, having had radiation exposure in the past can also be a risk factor. Now, when it comes to symptoms, the one that everyone knows, of course, is a new lump or mass in the breast that just feels different from everything else around it. But it's not just about what you can feel. You also want to look out for visual signs, too. Things like the skin thickening up or maybe some dimpling. You might even see a texture that looks kind of like an orange peel. That's actually a sign called peau d'orange, and it can point to issues with the lymph system. And hey, pay attention to the nipple area as well. Any sudden changes, like it starts to turn inward, or a new rash pops up, or there's some unexpected discharge, those are all really important clues. And this right here, this is a hugely important point. Knowing the signs is great, but many, many early-stage breast cancers have no symptoms at all. They're totally silent. They're found on a routine screening mammogram before a person feels or sees a single thing. And that is exactly why screening is such a game changer. So let's say a screening or a symptom does raise a red flag. What happens next? Let's walk through the really clear, methodical path that doctors take to confirm a diagnosis. Well, doctors use this incredibly powerful three-step process. It's called the triple test. It starts with a hands-on clinical exam. Then they use imaging, like a mammogram or ultrasound, to get a look inside. And finally, if it's still needed, they'll take a tiny tissue sample, a biopsy. The power is in combining them. Together, these three steps are almost 100% accurate.
The biopsy is the definitive step. It gives the final yes or no answer. But it does so much more than that. The biopsy is also how scientists identify that crucial molecular blueprint we keep talking about, the status of the estrogen, progesterone, and HER2 receptors. It's amazing, right? It perfectly shows how diagnosis and treatment planning are completely tied together from the start.
And that leads us perfectly into our final section, the strategy. How exactly is modern medicine tailored to fight this disease? Modern treatment isn't just one thing. It's an approach built on three main pillars. You've got surgery to physically take the cancer out. You have radiation therapy, which uses high-energy rays to zap any leftover cancer cells in that specific area. And then there's systemic therapy. These are medicines that travel through your whole body to hunt down cancer cells wherever they might be.
And honestly, if there is one thing you take away from all of this, let it be this. Modern cancer treatment is not one size fits all. Not even close. It is highly, highly personalized, and it all comes back to decoding that unique blueprint we found during the diagnosis. And this is where it all just clicks into place. It's like a strategic if-then plan. If the cancer has estrogen receptors, then the strategy is hormone therapy. If it's HER2 positive, then the strategy is HER2-targeted drugs. And if it's triple negative, without those targets, then chemotherapy becomes the main approach. It's just a perfect example of matching the right tool to the specific job.
So we've gone on this journey from a single tiny cell all the way to a treatment plan that's tailored to its unique molecular code. And that really leaves us with a very hopeful question for the future. As we get even better and better at reading these incredibly intricate blueprints, just how will personalized medicine continue to change the fight against breast cancer?